Anybody who has taken a water pill knows why they're called water pills.
They make you pee.
People with CHF have too much water in their bodies.
That's water in those swollen legs.
Those swollen legs are only the most obvious place that extra water in the bodies of people who have CHF.
The most dangerous place is the lungs. Water in your lungs can make it hard to breathe. That water might not be enough to drown you, but it's enough to block air from getting to the walls of your lungs, meaning your body isn't getting enough oxygen.
And you're short of breath when you're doing things like climbing stairs or even just sitting in a chair watching TV.
And then, of course, there's the heart thing.
The heart thing.
The heart thing.
Healthy blood vessels have a normal amount of blood in them. But when a person has high blood pressure, it usually has something to do with there being too much water in the blood, meaning there's too much blood volume.
A fancy way of saying too much blood.
Now, the blood is crammed into blood vessels, pressurizing them. And it's hard for the heart to pump blood into those high blood pressure blood vessels.
If you're a healthy person, your kidneys make sure your body doesn't collect too much water.
Healthy people like Joe here don't have extra water in their legs or their lungs or their blood vessels. That's because Joe's kidneys are doing a good job.
Meet Mr. and Mrs. Kidney. It's their job to make sure our bodies don't collect too much water.
Your kidneys have blood vessels in them. And in those blood vessels is a meter that keeps track of how much blood flows through per minute. 1 quart of blood is supposed to flow through the kidneys every minute. 1 quart, no more.
No less. Now, all of us, a few times a day, have more than 1 quart of blood a minute flowing through the kidneys. When that happens, Mrs. Kidney says,
I think that's too much blood flowing through, dear. And then Mr. Kidney answers,
You're right, sweetheart. I bet there's too much water in that blood.
And then both Mr. and Mrs. Kidney say, Time to pee!
Then the kidneys separate the extra water out of the blood.
And with it, extra water from the legs and the lungs.
And that extra water gets sent out the body in pee.
But when a person has congestive heart failure, their kidneys get confused and they don't order enough peeing.
And when you don't pee enough, water collects around your body, you guessed it, in places like your legs and your lungs.
So when that happens, it's time for Water Pill Man.
Water Pill Man to the rescue!
Water Pill Man doesn't take any guff from anybody, especially not from Mr. and Mrs. Kidney.
I don't care how much water you think is in this body. It's time for peeing!
And when people pee out that water, they have thinner legs, easier breathing, and more energy.
It's pee perfect!
Look how proud he is for making people pee.
I sure am.
He thinks he's Water Pill Man.
I am Water Pill Man!
Oh, brother.
Whee!
Okay, big guy.
But like with any medication, you need to look out for safety when you take water pills.
Number 1, no running.
Water pills can make you feel like you have to pee really bad right now. So people sometimes run to the bathroom, which isn't necessarily the best idea if you're 65 and have heart failure.
That's a recipe for a fall, which could break your hip and put you in the hospital.
My dad used to have a saying, it stinks getting old. Except stinks wasn't the word he used.
But back to the point.
Yeah, the point is, we all have accidents. But it's much better having the kind of accident where you have to change your pants than the kind of accident that breaks your hips and winds you up in the hospital. And look into undergarment protectors or protective briefs. You'd be surprised who wears them.
2, water pills can make you lose so much water from peeing that you feel dizzy.
If that happens, sit down so you don't fall down.
Then you give your doctor a call. Tell her that you're feeling dizzy and that you take water pills. She might want to do something about that, like lowering your dose.
And number 3, try taking your water pills in the morning so you don't have to get up to pee all night long.
If you take your water pills at night, you might have to get up to pee again and again in the dark.
Which is dangerous. You could fall.
And after you wake up in the morning, you'll probably feel tired and draggy all whole day.
So take your water pills in the morning and get a good night's sleep.
Number 4, if your doctor prescribes more than 1 water pill, take them all. You may need to take as many as 3 to get the water pill strength you need. But also, water pills affect your body's chemistry, especially when it comes to potassium, an important heart mineral. Doctors prescribe different kind of water pills together to keep that chemistry balanced.
And finally, things you have to keep in mind when you take water pills. Number 5, take care of your skin where it counts. Urine can be tough on the skin, especially between the legs and in the place just above your butt called the sacrum.
Be diligent about keeping the skin in those places clean, dry, and moisturized.